As we've reported, the idea of a COVID passport is being tossed around the U.S. It's already in use in other parts of the world. The ID would confirm that you've completed the COVID vaccine process. The idea has been met with privacy concerns. Vanessa Rufus dives into the concept and some of the ethical and legal questions experts are considering.
The vaccine passport is a hot debate. It's not just how to gather and store that info that has folks scratching their heads. It's also in what scenarios would you have to show it?
It is just so tricky. It is just, you don't know what to say on what's right and what's wrong.
And that's a sentiment playing out at many levels of the vaccine verification discussion. President Joe Biden said there will be no federal database nor mandated credential, but some states, including North Carolina, are working on a way for folks to officially prove their vaccination status.
We just want to be able to make sure that folks can access their own information about that vaccine for whatever purpose they may need.
But what purposes might there be? For work, to travel, to eat in a restaurant, or attend a football game? It's a complex discussion, so we went to Nita Farahani, a professor of law and philosophy at Duke University, for some points to ponder.
People think that a vaccine passport, if they know that all of the other people who are there was vaccinated, that would give them a greater sense of security. It might lead to people being more willing to participate in a lot of these activities that they've been hesitant to do. And that could be a big boost to the economy.
But Farahani warns in our haste to return to normal, we might create a new normal we can't rewind.
In moments of crises are the times when we give up the most rights and then we can never ratchet them back. We see that post 9/11, where we had a significant surveillance state that was established and has just expanded.
And this week, the World Health Organization reiterated its stance on vaccine verification, saying they should certainly exist for healthcare purposes, but need a little more consideration when you get outside of that realm. Will they reinforce inequities or widen the gap further for people who can't access the vaccine or don't want to get it?
If you come across something you want us to check out, you can email verify@13newsnow.com or just reach out on social media.